So, welcome to this very special spotlight episode of Rare. Today, I'm honoured to introduce a truly inspiring guest, Sarah Woods. So, Sarah joins us not only as a rare patient herself, but also as a rare mother, bringing both perspectives to the conversation. So, she'll be sharing her journey, the challenges and insights she has gained along the way, and also introducing us to the important work of the Serenely Guided Foundation, the non-profit organisation that she's founded to support and empower the rare disease community. So welcome, Sarah. I'm so excited to talk to you and hear your story. But let's dive straight in. So could you tell us a bit about yourself, your experience as both a rare patient and rare mother, and what led you to start the Serenely Guided Foundation?
Well, first of all, thank you so much for having me on. I really appreciate it. And I'm just so thrilled to be here with you. So thank you. My name is Sarah Woods, like you said, and I am a rare patient and rare mom to my son Sullivan, and he's almost 13 now. And we have a unique story, a diagnostic story of, it took me about almost 4 years to get diagnosed with a rare genetic blood vessel disorder called HHT. And within those 4 years, I noticed certain things about, what patients really go through when they're going through a diagnosis. And ironically, in 2023, when I received a clinical diagnosis, a year later, I noticed that my son was having similar symptoms to myself, such as like nosebleeds, stomach aches, headaches. And so recognizing those symptoms that he was having, I was able to set him up with the team at Boston Children's Hospital. And we were put in touch with a genetic testing and genetic counselor. And our testing through GeneDx was really, really great. He had his diagnosis within 4 to 6 weeks. So a lot different than almost 4 years. So we really just appreciated that, and it just opened my eyes to so many challenges that patients go through, which led me to start Serenely Guided Foundation. And it was really just wanting to help other patients with in any way I could, really just throughout their day-to-day lives, like meals. I noticed oftentimes I was going to so many doctor's appointments and like just trying to work and manage my son that we didn't like sometimes I was like, oh, where's this next healthy meal coming from? And so one of the things that the foundation does is we support with home delivered meals through a company that we partnered with, and were able to provide those through funds that we raise. And also like care boxes. I actually brought one. So we do custom care boxes for patients, and we work with a lot of like parents that have a child with cancer, and any pediatric cancer is considered rare. So they'll come to us and we'll provide them with a meal card or anything on their wish list that they might need, like clothes or other cards to support them through like treatment or even diagnosis.
Yeah. And what kind of support or impact are you hoping that the foundation can bring to patients and families?
Just I mean overall, like just a ease to the journey itself, really, and knowing the more people that get to know who we are and what we do, like that they don't have to wait for meals. I think a lot of oftentimes like you're waiting for insurance approval, or maybe your clinical trial won't cover meals, or maybe you're just going through diagnosis and you don't feel very well. So I think we just want to make an impact to make the patients and caregivers lives like easier with things of that nature, so that they also know that someone's there that cares and just wants to help, and they can get that almost instantaneously from us.
Yeah, no, it's great to have that sort of insight and perspective. So thinking about the rare disease community more broadly, then what are your hopes for the future?
Well, I think just for the rare disease community, really, it's a few things. I think for patients, I'd love to see more patient navigators and social workers, specifically for rare disease, so that it can help patients along the way with anything that they need. Because I think, again, oftentimes rare is so much different, or it takes so much longer, that if you had questions, certain questions to ask, or someone helping you along, it would just make everything easier, you know? And then I think also coming along with that is more affordable and easier access to genetic testing. I was lucky to find the Rare Genomes Project, and they were able to provide me with genetic testing at no cost, which was wonderful. And then my son had GeneDx testing, but I just think it could just bring a lot of ease to patients' minds if they had that access earlier on. And then I think the third thing would just be for future generations. I always think of my son and how well he's doing, and just to know that, and to provide this message where just to be your own advocate is so important. And, you know, I always tell my son, be the CEO of your health journey. So
Yeah.
I think just providing like that information to the younger generations will just help move things along to, you know, lead to better health outcomes for the rare disease community.
Yeah, no, definitely. I think just conversations like this are so important to help with patient journeys and that diagnosis. It's constantly spoken about how people with rare diseases, it's crucial to have that earlier diagnosis when it can take so long, as you said yourself, 4 years. But thank you so much, Sarah, for
Thank you,
taking the
Laura.
time to feature and for sharing your story. I will link any additional information to the Serenely Guided Foundation as well. But thank you so much.
And thank you.